Thank you for joining us for this segment of Live Healthy here at Trident Medical Center. Today we're talking joint replacement surgery with Dr. Jeffrey Conner of Trident Orthopedic Specialists. Thank you for being here.
You're welcome. Pleasure to be here.
So, orthopedic specialists, what made you choose this profession?
Right. So, orthopedics, when I was coming through medical school, everything, the world is your oyster in a sense. You can pick whatever you like. And really what I found was that I liked the patients the best. They had very straightforward, frankly, fairly simple problems. The bone was broken, it's in the wrong place, you put it back in the right place. Very straightforward. So I really enjoyed taking care of people that had straightforward problems and really wanted to get back to being really active, healthy lifestyles.
And one way you help patients is with joint replacement procedures. Tell us about that.
Sure. So the most common joints that we replace are the knee and hip. Slightly less common is shoulder replacement. And you can imagine why. The shoulders don't bear weight, right? We're not walking around on our hands mostly. And so the hips and knees tend to wear out more frequently. So yes, the hip and knee is the most common joints that we correct.
Used to think an elderly population, but now joint replacements happening at all different ages?
It is. You know, what we find is that patients' joints are destructed over different periods of time depending on how they use them and the wear and tear. And so, sure, patients are getting them done younger and younger all the time, but also older and older all the time, because what we find is that our septuagenarian and octogenarian populations continue to be really active as they age. And so our baby boomers, for example, are getting joint replacements done well into their late 70s and 80s.
What about athletes?
So athletes are a different population, but they do tend to have, because they have traumatic injuries in their youth, oftentimes they do tend to wear out their joints a little sooner. And so the nice thing is the technology now has allowed us to do partial joint replacements. In the knee, for example, we can replace simply one side of the joint versus the other, just the kneecap portion of the joint as opposed to the entire thing. Also in the hip, we have less invasive techniques that allow us to do smaller incisions and less joint destruction, less dissection, less removal of muscles and that sort of thing as we're doing the surgery. So that allows younger patients, more active patients, to get back to what they're doing more quickly.
All right. Well, thank you for joining us, Dr. Conner, and thank you for joining us for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.